Red dresses and pink ribbons have made millions of Americans aware of the impact of heart disease and breast cancer on women. However, not many understand how these two diseases could interact. Compounding the issue is that heart disease in women is quite different than in men, and women often need to be their own health advocates. It starts with education. Heart disease, the #1 killer of women, can sometimes be a complication of breast cancer treatment. Older women who survive breast cancer are more likely to die of heart disease than a cancer recurrence. Sometimes cancer directly causes heart problems, such as causing fluid buildup around the heart. Many times, though, the problem comes from treatments targeting cancer. Dr. Nitza Alvarez, cardiologist with the Tri-County Heart Institute, is passionate about women's health care. She talked to us about how women can advocate for themselves when talking with their doctors about heart disease and breast cancer complications.
Any cardiovascular disease specialist can treat cardiovascular disease. And one of the things that I try to make my practice be different is in prevention, and also women's and heart disease. When it comes to women and heart disease, we know that women are very different compared to our male counterparts. So I feel that as a woman, female patient might feel more comfortable talking to me. And you'll be surprised to hear how many times I get patients saying, my doctor thinks that I'm crazy. Or I go to the doctor with palpitations and they think I have an anxiety problem. That's my passion about women disease is how can I make sure that everybody knows that we're different through education, through caring for my patients, and also educating not only the patients but also the providers when to think about cardiovascular problem in a woman. If you are a cancer patient and you're receiving chemotherapy for your cancer, one of the things that your oncologist is going to want to discuss with you is the alternative therapy that are available for you. Some of the drugs that are used to treat cancer can be toxic to your heart. They can cause a weakening of the heart muscle, and it can translate into congestive heart failure. Some of those drugs are still used for management of cancer. Your provider will advise you and will let you know. However, if you haven't heard that any of the chemotherapy that you've been using can cause any cardiac problem, but you've been feeling more short of breath, or you notice that you're retaining water, or the ability of performing your regular activities are jeopardized by shortness of breath, you probably want to discuss with your provider. They might want to obtain an ultrasound of your heart perhaps, or a MOGA scan, some type of evaluation of the ability of that heart from pumping blood. The heart is a pump, and if the drug is affecting the muscle, it's going to get weak. So patients can develop cardiomyopathy, congestive heart failure, related to the drug that they're using. More often than not, locally, eliminating the toxin from the system will help that heart recover. So that's the beauty of it. Eliminating the drug will help the heart recover. So know what drugs are you taking and discuss with your doctor what are the possible side effects.
Walk with a Doc has been on hold for a couple of months while the community adjusts to the COVID-19 pandemic. But follow Tri-County Heart Institute's Facebook page for the most current information. Once they resume, you can join Dr. Alvarez the second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. You'll find information on Walk with a Doc and the Tri-County Heart Institute when you click on the Heart's pink link online at yourhometownhealth.com.